Here are the two ideas we're going to be struggling with today: integration and innovation. And this is kind of what we hope for, isn't it? We hope to take all these tiny little elegant pieces, these beautiful things which are wonderfully crafted by themselves, but don't really work until we all get them together in something called a watch. And of course, we don't have anybody to wind the thing, so we're going to need to have a solar battery in it so that it's sustainable. But this is our hope, our dream for integration. And integration can mean a variety of things, as John said. There's at least two fundamental meanings of it. One is to take all the Millennium Development Goals and put them in a one-stop shop so that people in villages don't have to worry about whether a program is going or not going. They can go and get what they need. The other is a vertical integration, in which the quality of the service, its price, its accessibility, messages about it are all integrated at the same time so that the program itself is particularly effective. And then, as you're going to talk about today, there are dozens and dozens of permeations of these two facts of integration. When you think of innovation, I think words like continuity and boredom and stagnation also come to mind. Because the reason we want to innovate is because we're bored. And I can't tell you how many times in my career I literally saw people who had been working on something just bored and wanted to do something new. The reason we need to innovate is because we're stagnating, not because we're boring or bored. And we have to make the decision between, am I doing this just because I'm bored, or am I doing this really because I need to do that? And innovation has become apparently the only way to change the world. It's just the only thing we believe in anymore. We can't change it anyway unless we innovate. And I have to tell you, there are lots of ideas out there that people want you to use. Every new book is about an innovation. Did anybody ever write a book about, this is the same old thing? You wouldn't pick it up, you wouldn't read it, right? Nudge. How many of you read Nudge? How many of you have heard of Nudge? Well, Nudge, I thought everybody heard about Nudge when the Washington Post reported that all of Obama's team was reading it and that it was the future of development. Nudge is a book about behavioral economics, and most people who say they know about it haven't read it, and they've reduced it to a single idea called defaults. In fact, Nudge is an introductory, it's like a tourist in a country of behavioral economics. It sort of takes you around and you taste a little bit of the local food, but you don't really know very much the country when you're finished reading that book. But hundreds and hundreds of people around the US are getting involved in nudging now instead of changing behavior. And all of these books represent innovations that people want you to buy. Everybody's got an innovation for you, and many people in this room have an innovation for you. And this is kind of what we think about. Incidentally, this is not a dream. This is going to be available in a couple of years, I understand, where your phone will actually project a keyboard that you can type into and change what's on the surface of your phone. Now, what do we like about innovation so much? Well, it is fun, isn't it? I mean, it is a giggle. I mean, it really turns us on. You know, you get that kind of, oh my God, this is so hot. I've got to get one of those things. I want it now. I want it now. Innovation is exciting. Now, integration isn't, I got to tell you, and integration isn't innovative. We've had integrated development, integrated pest management, child development, marketing, integrated circuitry. This is my favorite one, integrated human-centered systems approach to the development of advanced cockpit and air traffic management systems. That's really boring. But innovation, that is exciting. That is fun. You're the only one in the room who's yellow. I mean, that is really cool. So if this is integration, this is innovation. This is the happy side of us, right? So, you know, we want to think about these two things together. So our real question is, how do we innovate in order to produce an integrated and sustainable impact on the Millennium Development Goals, which we all know are these? And the Global Health Initiative strategy sort of reiterates this. Integrating the delivery of health interventions is essential. We need to have comprehensive health services if we're going to be truly successful. So this is the grand goal. Let's see how we're doing. I don't quite understand this chart. sometimes red things are good and sometimes red things are bad. I don't quite get that. So I stopped paying any attention to the colors and just looked at sub-Saharan Africa and found out that we're doing pretty well in education, particularly on primary school participation. But everything else is lagging a little bit behind. Now, I worked on girls' education for a long time, and we all promised everybody that once we got women educated, we really weren't going to have any more development problems, that they were going to manage the home, and they were going to raise money, and they were going to kick the drunk guy out, and they were going to take over, and things were going to be better. We have improved education, but everything else hasn't improved ordinately. And this may be our best argument for integration. When we achieve these single achievements, they don't necessarily spill over and affect everything else. How did we get here? Well, when I was a Peace Corps volunteer in 1840, right before the Civil War, in Latin America, aid was called Punto Cuarto, the Mission for Peace, Point 4. And that was sort of the first effort that got us into all of this stuff. But the first era in development was the Green Revolution and family planning. And this was the era of technology transfer. This is definitely where the white guy had all the answers, and we were just going to take our technology, drop it in with all the nice folks of color, and solve development problems. Except in China, where they began with a totally integrated primary healthcare system called the Barefoot Doctor. When I started in development, this was a book everybody had to have on their shelf, Where There Is No Doctor. It was, the idea was we could make a village guy into a doctor. And the focus here wasn't so much technology transfer as it was training. This didn't work out too well for two reasons. One, because the expectations for these people were far too high. And secondly, when they returned to their villages, they weren't seen as doctors. They weren't any more credible than they were when they left. And the traditional medicine guys beat them out every time. Except for a few cases. If you look at BRAC, and you look at the experience in BRAC, it's very impressive having been able to manage this very local grassroots effort on a large scale. Because we've had millions of experiments. I mean, that is one thing. You can prove, by taking a case example of something, you could prove anything works in the world, because somebody has done crazy stuff someplace. But when you say, how are you going to make it work for 300 million people, that's when the problem begins. These were the other guys who came on the field. These are the three heads of the smallpox eradication program at CDC over the 10 years that it existed. And these guys made a big difference in the world. They changed the conversation. They reframed the issue significantly. This is D.H. Henderson. I don't know if any of you were privileged ever to know him. Extraordinary fellow who actually spent some time afterwards thinking about what had made smallpox eradication successful. And these are his words. Innovation was at every level, despite senior leadership. I want all the guys to hear this, young people. Okay, you can go to your boss, and say, hey, it was despite my leader that I got this done, so I need to do this despite you too. But they developed new vices. Epidemiology was restructured. They actually discovered that the vaccine worked better than they thought. They discovered there was no animal reservoir. Lots of debates about that at the beginning of the smallpox eradication program. And the effort was working efficiently and effectively. This was an incredible example of the vertical integration I told you about. And I want to take just a second to read through some of the things D.H. Henderson said, because if you're going to take notes about anything, these are the things you ought to take notes about. This is where I believe, after a long time, that innovation really comes. We were able to shift strategies in midstream. We switched to a simpler solution of a needle. We figured out the needle we were using right in the middle of this huge campaign. We just changed the needle. Field workers consider themselves co-researchers. They weren't partners and participating along with people. They were co-researchers. They had authority to make decisions. The data that was collected in the field was distributed immediately to people, and this was long before cell phones and any of that kind of stuff. These guys worked their tail off to make sure that what they were finding in one village was being used in another village. Everything was open to question. There was no dogma. No dogma. And this is the one that I think is most important. All headquarters staff spent 1/3 of their time in the field to reduce the gap between themselves and field workers. 1/3 of every bureaucrat's time spent in a field. That would revolutionize what we do. And the policies and promoted the collection, listen to this, of accurate rather than politically correct data, which means we're failing, we've got to let people know so we can fix it, rather than, well, we're not doing well as we should, but it's really a great success. These, I think, 40 years ago, are some of the lessons about what makes innovation happen, whether you're working on smallpox or anything else. Yes, innovation can be found in the past. So we wound up with these two somewhat competing paradigms. Were we going to integrate or were we going to target? And these folks at the bottom said, you know, be sure and let us know when you guys decide, because we can't quite figure it out. This is our history. Huge emphasis on family planning, moving to child survival. AIDS hit, girls' education, malaria, TB, and AIDS together. Many of these headed by extraordinary men. I don't know if any of you knew Ray Ravenholt. He was sort of a god when I came into this business. I mean, this guy was really organized. Jim Grant, who had an ORLT packet every place he went, pulled it out of his pocket. Jonathan Mann, an extraordinary young epidemiologist. And now Bill and Melinda Gates, of course. I could not figure of a single figure in girls' education. Give me some, tell me who that would be. Whose picture should I put up here? Name should I put up here? Why is that? This isn't a rhetorical question. I actually don't know why this is. This is the best I could come up with. Because there was a time at which the whole role of women was changing dramatically in the world. And that's why we came into girls' education. But I couldn't think if there was a single person. What is clear was this huge sucking sound over this history as dollars and talent moved from one of these to another area. We didn't add them on. We took money from one to build the other, and then money from that one to build another. This was the era of the moving magic bullet. As soon as we had something new to do, and the malaria news, you know, kind of supports this, kind of says this magic bullet stuff kind of works. We've had, significant reductions in deaths and cases in the past 10 years. And these were all driven by two factors. They were driven by epidemiology, and they were driven by innovations, things we could do, so we did do them. The pill, new vaccines, new feeding practices, bed nets, a variety of things. I think it could be made that innovation has been the enemy of integration and continuity, and not its friend in our history. I don't think it has to be that way, but I think you're here to decide how you can change that. And this is the disturbing part. These things are not good bedfellows. At the rhetoric level and at the reality level, integration always makes sense. But when you start putting it together in the delivery cycle, we still wind up with these silos. And of course, while we always argue we need more money for everyone, I'll be sure I get mine first, has been very typical of our community. So is there any evidence that integration makes things better? Logically, it makes things better. We have lots of logic models. We've got a great schematic model that shows us, of course, it needs to be integrated.